If a man has a heart attack in Horton, you might well be dead.
It's been over 2 years since the hospital in Horton, Kansas closed. After years of financial problems, it finally went under. At the time, the closure left folks like the ones at this senior center with no place in town to get health care.
It is very good, yes.
We didn't eat any breakfast.
Has it impacted your health care since the hospital closed?
It has. During that time, we've not had any hospital care here at all, no emergency room. I'm a strong believer in health care being available. I'm also a strong believer in that it has to be paid for, and if you can't meet your payroll or you can't pay your bills, then how can you stay in business?
Rural populations in the U.S. are shrinking as more people move to cities and suburbs. And those that stay tend to be older, often poorer, and are more likely to suffer from conditions like heart disease or cancer. But the places that would care for them are disappearing. In the last decade, almost 10% of rural hospitals closed. That means people who remain have a harder time accessing both basic and emergency care. Here in Kansas, 3 out of 4 hospitals in small towns are at risk of closure. The emergency room and all inpatient beds in the 2,700-person town of St. Mary's shut down this summer. Todd Willert made the final call to close the doors.
How much money were you losing at that St. Mary's facility?
We were looking at probably about $500,000 to $750,000 loss.
And that was just something you could not survive?
Absolutely not. There is no way.
It's more expensive than ever for community hospitals to stay open, as the cost of labor, technology, and supplies has increased. But in Kansas, the money coming in hasn't kept up. In 2019, public and private insurances didn't reimburse $22 billion in medical charges, 2 times more than 2011. The pandemic has only made it worse. Struggling healthcare systems lost even more revenue when they were unable to do more profitable procedures.
Surgery volumes went down 50, 60, 70% in a lot of areas because all of those elective surgeries, which are really important to the bottom line of a hospital, were not being done.
Do you have an obligation to provide health care to people?
Well, I think we are meeting the obligation to provide health care down there. We do have a clinic. We have the lab, we have the x-ray, we have physical therapy.
What are you all making here?
So we're making residential cabinetry primarily.
If someone is using that and it cuts off their finger, what do you guys do?
We'll wrap it up and usually right across the lawn. That's what we used to do.
Kevin Gray runs a woodworking shop across the street from the old emergency room.
The local healthcare system has said that there is essentially no need for an emergency room here in St. Mary's. What is your response to that?
Yeah, I'm not sure I agree with that. I think maybe there might have been times where we had a cut that without having them there that they may not have got the proper care they needed immediately. It was a luxury, I think, that we had that we didn't realize.
Hospital closures are devastating for communities, even beyond access to care. Horton lost revenue, jobs, and people left. And then there are all the businesses that relied on the hospital.
You know, I estimate my loss at somewhere between $50,000 to $60,000 a year.
Tim Lentz is a former mayor of Horton who owns the convenience store in the center of town.
What's your receipt there?
Nothing.
Thank you. You have a good day.
How do you calculate that financial loss?
Fuel for the ambulances and general business and general employees coming in to see us on a daily basis for 3 meals a day sometimes. When a town loses services and a town loses major job loss, I mean, the town is going to do nothing other than decline unless there's something else to economically impact it, and right now we don't have that. It's a very sad situation to go from a town that population was over 5,000. We're now at around 1,600 and some people right now. We've lost a small rural community hospital in an elderly community in dire need of health care. It's what we've lost.
About 50 people lost their jobs when the hospital closed, a noticeable number in a town with a small population.
You're probably not going to want to look at all of them. But
Oh my gosh.
that's
more than one.
well,
Mary Oswald worked there for almost 30 years.
my mother worked at the hospital. My aunt worked at the hospital. I don't think any of us could imagine the community without the hospital. It just takes a long time to, I guess, accept the shock that it's gone.
Do you think that there's a healthcare crisis in rural Kansas?
Mm-hmm. There's things that a rural hospital can't do, but it's that intervention and getting things moving quickly that affects the outcomes. Time in an emergent situation can mean life or death. I think we need some kind of a system in place that people know, there's going to be care available. And I know the clinic is trying to provide health care in the community, but I don't know how well they're doing.
Do you worry that Horton might not be here in 50 years?
Well, it makes you wonder. It took a big chunk out of Horton.
And you, it seems like, too.
Yep. Yep.